As you may already see it over here, the aorta is connected to the RV and the PA is connected to the LV. So TGA, switch. Huh? So that's why the corrective surgery, which is done for it, is called as the switch procedure. You just take the left to the right and right to the left. And if you change the valves, what type of surgery it is called as? So, for example, there was a great surgeon. Okay, now I'll try to give you all a hint as well. Under whom Dr. Devi Shetty was trained in Guy's Hospital, London. So that guy was a great pioneer. So he noticed like what was happening is the aortic valve, because it tends to bear so much of pressure changes, the systemic circulation to the aortic ones, so it tends to get damaged. But what was happening is the one on the pulmonary valve area, it never gets damaged. So what he thought, rather than what if I just switch? So for example, the I put the aortic valve into the pulmonary position and pulmonary into the aortic. What will be the benefit? So the patient doesn't need any anticoagulation and all, and still just with you need not manufacture, another valve as well. It cuts down the price, and it's great, isn't it? So who was the pioneer for that? He was also given the honorary title of Sir Ronald Ross procedure. Anyways, okay, that is different areas and all. Too much of diversion. We already did it for today. So, as I said, even in this, there are two types of transposition effects which we all can see. One is the oxygen uh, poor blood, which will be, of course, blue. So, that is the one which tends to come to the right atrium from the body. It will be passing through the RA, RV, and of course, into the disconnected aorta back to the body. On the other side, the oxygen rich blood, it tends to return to the left atrium from the lungs, which will be passing from the left atrium and ventricle into the pulmonary artery and also back to the lungs. So, if we see it over here, what happens is, what about the clinical presentation of the patient? So, it's almost pretty much similar like one, but there will be some notice, will be there in fact. Okay. So, what about the management? What's the procedure specially done for such kind of patients?
Is it pre-intubation oxygenation?
So, what happens is, as I had said, if patients are symptomatic, we will have admit to NICU, need ventilatory support, even cardiac catheterization as well. May also do plan and by the second week of is done, This is called switch off. Okay. Now, what is happening is there's a big role plays of gene therapy as well, especially for congenital heart disease. So what happens is nowadays in the human genome has already been mapped, and it has been studied very much detail, trying to see for what are those possible genes which can be causing the heart